All right, guys, this is Dr. Chapman from Chapman WellCare. I laid out a few things that we use in the office on a regular basis in no particular order. I just wanted to show you some of the tools we use for different minor procedures that can be done. So come see us, let me show you some of the things, and let's just go down the list. So over here we have what's called a Dermabond pen, and this is great for small lacerations on the face or areas where cosmetically, if the cut is not deep, and we're worried about a child and maybe doing stitches and the quality of those stitches in certain cuts, we can use a Dermabond pen, which is basically like a medical grade super glue, and this is a great option for some patients. Over here, this is just a simple suture removal kit. So whether we place stitches or someone else places stitches, you can give us a call and we can remove that for you. Sometimes different stitches like these here, they come in different colors, they come in different sizes. So sometimes we'll use nylon filament because of the strength, or sometimes we'll use an absorbable suture if we wanted to absorb and not worry about having to remove it again in a smaller child. That's important. And then over here we have pediatric staples. So sometimes kids will have head injuries or small cuts in the scalp, and we can apply staples, which for strength and cleaning purposes, this is one option. We have adult size staples depending on the length and the location. Another option to close cuts. Over here we have what's called thermal cautery. You pop this cap open, you press a button, and there's a wire conductor that heats up. This is great if you were to numb a small skin tag or a wart. You can burn that lesion off. Or sometimes if you have a part of the body that's just bleeding for whatever reason, you can apply thermal cautery to stop the bleeding. These are all things that we can do in the office. These are just typical numbing medications. You have your good old lidocaine, which is fast acting and lasts a little bit. And then you have your longer acting bupivacaine. So for example, if someone came in with dental pain and they just needed a few hours of relief, even though we would eventually refer them to a dentist, sometimes they just need temporary relief. We can numb up that area of the jaw, numb up that area of the tooth, get them some temporary relief. But bupivacaine goes a long way too, and sometimes we will even use this in conjunction with some steroids, and we do a lot of joint injections in the office, whether that's a knee, a shoulder, an elbow. So people who are dealing with acute on chronic joint pain, we can mix a long-acting steroid with a long-acting anesthetic, and that's very, very helpful for patients who have orthopedic issues but aren't necessarily surgical. And over here we have some of the things that we use for nosebleeds. We see a lot of patients with nosebleeds. Again, nosebleeds are very common in children. They're very common during cold and flu season when the nose is being manipulated. This is what's called a rhino rocket, and sometimes with very difficult to control nosebleeds, you can inflate this balloon, and it cuts off blood flow to that difficult to control nosebleed, and we do this quite a bit. There's other simple things that we can do in conjunction with controlling nosebleeds, like using different medications to constrict the blood vessels. So sometimes just pinching the nose and using good old vasoconstrictors to constrict those blood vessels goes a long way. And these are also some things that you can do at home, because sometimes you can get these over the counter. This is a chemical form of cautery. On the tip of this applicator is called silver nitrate, and you apply this to maybe the inner portion of the nose, and instead of using something thermal, which would cause a very significant burn, if there's a tiny little vessel that just continues to bleed, for example, when in a nosebleed, you can apply this and sometimes try and stop it with minimal disruption of scar tissue and things like that. And sometimes we'll use this, which is just a topical numbing medicine. So if we are to cut an abscess open, or we have to pack it, there's different ways to numb up the skin, numb up the top surface of the skin so patients aren't in pain. Over here we have what's called alligator forceps. This is great when you're trying to remove a foreign body, like believe it or not, sometimes we will have insects that get in the ear, or BBs that get stuck in the nose. You wouldn't believe some of the things that we see. So overall, these are just some of the things that we use, and these are all things that we're capable of doing. So give us a call at 239-359 6500 or visit our website at cwcnaples.com. So you can learn a little bit about some of the procedures we do. You don't have to wait for an appointment. You can call us. We know how busy life is, and these are just some of the things that we do. And thank you very much.